Hello, good afternoon. Welcome to Supercharge Your Healthcare Practice, Practical AI with Microsoft Copilot. Thank you all for taking time out of your busy schedules to connect with us today. My name is Kate Smith, and I'm the Vice President of Client Success here at IT Solutions. I'm joined by Tyler Sanders, who is our Vice President of the Solution Enablement team, and we're excited to discuss how Microsoft 365 Copilot can supercharge healthcare practices. More specifically, we're going to share how you can leverage and effectively adopt AI in a way that enhances productivity without compromising on data privacy or security. Thanks to our existing partnership with Microsoft and dedicated clients like you, we're able to help guide you through this evolution. Hi, Tyler. Thanks for joining me.
Thanks for having me, Kate. This is a popular topic, so I'm glad we're getting in front of our clients and showing them ways to adopt Copilot.
Me too. Okay. Before we dive in, I do want to cover a few housekeeping items. All of our attendees are in listen only mode to avoid any feedback or bandwidth issues. The webinar is being recorded and will be made available to all registered attendees. Please look for the recording in your inbox in the coming days after today's session. We absolutely love questions, so please use the Q&A button on the bottom of the Zoom window, and we will be happy to field all of those questions at the conclusion of today's event. So AI is really reshaping how healthcare professionals work, and Microsoft Copilot is really leading the charge. Today, we'll discuss how Copilot integrates directly into Microsoft 365 tools like Word, Outlook, and Teams to streamline everyday tasks, empower your staff to accomplish more, and enhance customer service. We'll also explore real use cases tailored to healthcare practices, break down cybersecurity and compliance essentials. We'll talk about how to get started with a successful Copilot rollout. Whether you're leading a healthcare practice or managing operations or supporting your organization's technology environment, today's session will equip you with practical knowledge to make your organization smarter, faster, and future ready. So let's start today with why are we here talking about AI? And more specifically, why are we talking about Microsoft Copilot? We've been seeing a massive surge in interest around AI. Tyler mentioned it at the start of our call today. Most of our organizations of all sizes are asking us about AI. In fact, Microsoft found that over 90% of business leaders have used AI tools. But this adoption by employees at large often happens in fragmented manner. Employees are using different public AI tools that aren't governed, which can put a healthcare organization's data at risk. Some organizations have even banned AI use due to these kinds of concerns. But that's really where IT Solutions comes in. As your trusted IT partner, it is our responsibility to help you understand and adopt AI securely so your team can use it with confidence and capitalize on the benefits. Before we dig in and start talking about the use cases with Microsoft Copilot, I do want to quickly cover some basics of what AI is and what AI tools really are. So AI tools like Microsoft Copilot are large language models, or LLMs for short. These models are trained on vast amounts of text to understand and generate human-like language. A common type of LMM is a GPT, which is short for Generative Pre-trained Transformer. It's easier just to say GPT, which is just technically a way of saying it can predict and generate natural sounding language by understanding context. Some well-known tools that fall under this LLM category include Microsoft Copilot, which we're talking about today, ChatGPT, which is very popular, as well as Google Gemini. Each of these tools is powered by LLMs behind the scenes. but how they're used and how safe they are really depends heavily on where and how they're deployed. When organizations first start exploring AI assistance, employees often think of ChatGPT, which is powerful, but also disconnected from your business processes and any cybersecurity policies. This is one of the many reasons we're recommending Copilot, otherwise known as Microsoft's AI assistant for work. As we just discussed, Copilot is a large language model and is directly embedded into the tools you already use, like Word and Outlook, Teams, and Excel. It will help your healthcare practice get more done by summarizing information, generating content, automating repetitive tasks, and so much more, all within the security of your Microsoft 365 environment. What's also great is that it's not necessarily a new platform to learn because it already leverages the tools and applications that many of us are using today. Moreover, AI isn't just a trend or a buzzword. We're here today because it's a competitive differentiator and advantage. Organizations that adopt it thoughtfully are seeing improved efficiency, faster decision making, and empowered teams that can accomplish more. Microsoft Copilot provides the best of both worlds. It drives creativity and productivity while adhering to existing policies and uses Microsoft's enterprise-grade security. So let's dig into the security piece a bit more. Often, this is where the conversation goes when our clients start talking about AI, is immediately around security concerns. So Microsoft has built Copilot with enterprise-grade safeguards from the ground up. This means that your data stays your data. It's not used to train public AI models, and it's protected within your existing Microsoft 365 environment. Such an important piece to understand. Every interaction with Copilot honors your organization's compliance policies and security settings, including role-based access and information protection. But ensuring Copilot operates securely and effectively in your environment requires thoughtful preparation, like proper data discovery, identity configuration, and security hardening. We're going to dive into all of that in a little bit. But please know we are available to continue the discussion with you after today's session or at any time that's needed. For additional peace of mind, Microsoft's customer copyright commitment ensures you're protected from claims when using their AI tools responsibly. In short, this isn't consumer AI. It's secure, it's compliant, and designed for professional use at scale. Microsoft 365 Copilot is an add-on available for Microsoft 365 for Business suites. You have options, and the plan you choose determines the level of security and compliance controls available to your M365 environment and Copilot, protecting your data, devices, and applications. Microsoft 365 Business Basics and Business Standard, as shown on the left, provide foundational security controls, including multi-factor authentication via security defaults, to help safeguard your healthcare practice from identity-related attacks such as password spray, replay, and phishing. They also include standard compliance controls allowing users to search and export Copilot interactions, log user activities, and apply retention or deletion policies. Microsoft 365 Business Premium, as shown on the right, offers more comprehensive security controls, which include everything in the Business Basic and Business Standard, plus more. Conditional access with Entra ID builds on MFA and other areas to add more capabilities to search and exporting Copilot interactions. Business Premium also allows the use of manual sensitivity and retention labels for files and emails. Users can protect access to sensitive data in Copilot interactions with DLP or data loss prevention policies. This slide really is designed to provide a high-level overview of the controls, but there are additional add-on features available within the Office and Microsoft 365 for Copilot functionality. As we continue the conversation around security and control, it's important to understand the difference between a free, unlicensed Copilot subscription versus deploying the fully licensed solution. An unlicensed Copilot chat offers basic functionality. You can enter prompts, you can ask questions, you can even upload files, but it does operate isolated from your Microsoft 365 environment. It doesn't have access to your internal systems, it can't access communication history, and most importantly, it can't gather information or be held accountable to your organization's security policies. By contrast, the licensed Copilot is built to work inside your Microsoft environment. It's connected to a private, secure instance of the AI model that's integrated with your tenant. This allows licensed employees to pull in relevant content from Outlook, Teams, and SharePoint, making Copilot smarter and more context-aware without compromising data integrity. That
Yeah,
integration is really what makes the licensed Copilot solution both more powerful and more secure. It honors your Microsoft compliance settings, it leverages existing identity and access policies, and it stays entirely within your protected cloud ecosystem. Our team is always available to discuss the best path forward. Whether all users licensed or some or in between, we are happy to help you determine a licensing strategy that meets your needs.
Yeah, and I know we're going to get into the three-phased approach that we take in deploying Copilot Cape, but it's good to point out that in a lot of organizations, a lot of our clients' environments, we're seeing people using ChatGPT, an unlicensed version of that. And the good alternative is at least getting the unlicensed version of Copilot in place because of all the data security points that Microsoft takes that you already identified over the ChatGPT platform. So that is part of our recommendation as we deploy it in organizations, is set a policy around it and standardize on the free version of Copilot over ChatGPT.
Perfect. Thank you so much. Tyler, would you also walk us through really through some of the challenges that our healthcare organizations are facing, and how can we use AI to tackle some of those challenges?
Yeah, thanks, Kate. And this really, anytime you're deploying a new technology or a new piece of software, any type of solution like that, you really want to be able to identify what are some of the pain points and what are some of the use cases that you can leverage this new technology for. So when we look at the healthcare landscape, we know that you're dealing with, high volumes of patient data. You're dealing with complex systems that don't always integrate and can cause, incompatibility issues. There's constant pressure to balance care quality with protection and efficiency. And then on top of that, the entire industry is shifting fast from new regulations to evolving care models. So when we look at these challenges, that's where, Gen AI tools like Copilot can make a real difference. They're helping healthcare teams increase appointment capacity through better scheduling, reducing some of the administrative backlog, even summarizing lengthy medical records in seconds. And with the right setup, then you can deliver more personalized communications to patients without adding to your team's workload. We're going to get into, this is just a few examples. We're going to get into some more. We'll do some screen shares on some use cases so that you can get more familiar and see it in action. So Microsoft has published use case, case studies by certain verticals, and here's one for healthcare. So the situation is Cry, a digital-first healthcare provider, was faced with increasing administrative demands, rising patient volumes, over 200 million patient interactions, and the organization needed to improve efficiency, reduce the clinical burnout, deliver more personalized care at scale. So they worked with Microsoft on leveraging Azure, OpenAI service, and Microsoft 365 Copilot. So they were introduced to the generative AI to streamline administrative workflows, automate documentation, enhance care coordination between clinicians and patients. And the impact from that is by integrating AI into the clinical and back office processes, CRY reduced administrative time, improved clinical productivity by about 20%, and enabled 10,000 additional patient appointments monthly, including more personalized care and better work-life balance. Products they use: 365 Copilot, Azure OpenAI Service, and the Microsoft Cloud.
That's awesome. Thank you, Ty. I love how it's efficiency, but it's also about improving, patient care and overall experience. It's a great use case.
Yeah, it is. Mel, do you want to, just take us through how, being able to follow meetings in Teams, and I think there should be some dialogue that goes with this video.
Imagine you have an appointment that conflicts with your weekly business review. What if you could do both? With Copilot, you can opt to follow a meeting. After the meeting ends, Copilot will summarize what you missed. You'll get a notification in Teams when the recap is ready. This recap will highlight content that was shared, summarized notes, and any action items for you or others whose names were mentioned. You see that one of your customers was discussed, and you want to learn more. You can ask Copilot clarifying questions, and it provides a detailed response. It can tell you why a certain decision was made, and gives you helpful context. You can even ask Copilot what other solutions were considered. And it provides citations from the transcript so you can see where Copilot drew these conclusions. It's a huge time saver.
That's a great use case and an easy place to get started. I think, at ITS, that was one of the first things we started using with Copilot. Even if you are able to attend the meeting, what we do at the end of every meeting and during the meeting is we call out people and action items, next steps, so that everybody can get a transcription of the meeting, understand clearly what was discussed, what the next steps are, takeaway items, and just a really good way to summarize it. So rather than having an individual in the meeting take your meeting minutes and sending those out to everybody and stuff, now you can just easily automate that and have it automatically send out and include the people that weren't in the meeting, as that video showed. Oh, yeah. So this next example, go ahead and you can hit play on that, Mel. Thanks. So this is a common example. We use Copilot a lot for email, but in this example, what it's going to do is it's going to summarize a long email thread. And this is really helpful if you all of a sudden get added to an email where there's been a lot of back and forth. Maybe it's been going on for weeks and now you're getting brought into it, and you start scrolling down and seeing that, there's been 2 weeks of email correspondence going back and forth. So because this is using the licensed version of Copilot, you can easily go click to summarize what was in that email. It's going to give you the summary of all the key points that were discussed. And now what it's doing is it's actually drafting a response back to the thread based on all of the summaries that it was pulling together. You can select, different tones that you want for the email. So if you want it more casual, if you want it more formal, you can continue to input more parameters around how you want it to respond. And then what you'll see here is it's going to create this draft. It will give you the option of whether you want to keep it, discard it, or regenerate it. So, after a quick review, you may want to augment that slightly, or change it, or just send it as is. And because it's integrated in, you can select to keep it, which is what I think it does in this example, and then send away, and there's your email draft response. I typically like to give it a more thorough review, make sure what it's responding back is accurate, but that summary, it's a good way to get a head start on it and really fast track through it. But always putting your own interpretation on things, I think, is good advice. Let's move on to the next example. So this is a different workflows that are tied together. So there's ways that you can continue to develop Copilot through agents and string a number of tasks together, or just start by working on these tasks independently and then figuring out if you want some sort of workflow that strings them all together. But this is where Copilot starts to show its practical value. It's streamlining communication, documentation, and access to information in ways that reduce friction and free up time for patient care. So, from appointment summaries to meeting recaps, Copilot helps staff stay organized and on the same page to reduce manual effort and improving internal coordination. It assists with medical management, quickly referencing the location of and pulling prescribing information so clinicians can make informed decisions faster. It enhances education and training by helping generate clear summaries from patient notes or operative reports, reducing time spent on documentation and improving knowledge transfer. So the
Mhm.
result, shorter wait times, stronger team communication, better patient satisfaction, and from an organizational perspective, this will drive some cost savings, improve staff productivity, and without sacrificing quality of care. So this next example will pivot from care delivery to communication, specifically how healthcare teams can create educational content to better engage and retain patients and members. Copilot also helps administrative teams like marketing streamline how they research, draft, and refine communications, making those processes faster and more strategic. So here's a great example where a marketing specialist can prompt Copilot to summarize recent patient reviews, public health trends, and best practices, saving hours of manual research. Copilot helps surface the most pressing questions your patients are asking, which guides where to focus messaging and outreach. Then, using Word and Copilot, content can be drafted in minutes, such as patient portal instructions, brochures, FAQs. Copilot can revise for clarity or translate it in seconds, allowing your team to deliver content with confidence that hits the mark. So the results here, faster content creation, better engagement, fewer support inquiries, while strengthening member relationships and improving satisfaction. So at a higher level, this drives brand awareness, revenue growth, and member sentiment, all with less manual effort.
Tyler, thank you so much for walking us through those examples. I think it's really helpful when we talk about Copilot and AI. The possibilities are almost overwhelming that clients are unsure where to get started. So seeing some use cases enables us to start that conversation, much easier. So again, thank you so much. Um,
Yeah, and Kate, I think to your point, the more you start using Copilot and the more you engage with it, the more use cases you find with it. So I started off, using some basic meeting summaries, like one of those examples, helping to draft
mhm.
emails, helping to draft documents. But you can really start to, see the power as you drill into some more workflows and more use cases from it, and get better at it. So. What we've done though is we put together a program that's really a three-phased approach on how to deploy Copilot securely and actually make the most use out of the rollout from it. So we want to make sure that not only are we securing the environment, protecting your data, protecting patient information, but we're also making sure that we're empowering you to go away and have some real world use cases that you can take advantage of so that you hit the ground with some specific workflows that you can optimize within your organization. So we start off phase one, it's a discovery and readiness phase. And this is where we want to go in and we want to really understand where your data is and where there's possible opportunities to leverage Copilot. So we'll look at SharePoint sites, we'll look at OneDrive, we'll look at Outlook, all of those different areas, any integrations you have to other applications that maybe are Copilot enabled. And then we'll put together, what is the next phased approach of this. We're also looking very closely at the security side of things because we want to understand by discovering where your data is, we also want to understand what the security parameters are around it. Along with that, the external security, so that Kate touched on it in an earlier slide, where there's all the controls within the 365 environment on how to control the Microsoft 365 and Copilot environment from external threats. But we also need to make sure that we're managing the data internally so that there's the right data classifications put on data so that people within your organization aren't able to access data where they shouldn't have access to it. So from this discovery and readiness phase, we then move into the actual implementation of the security and data protection. And then once that phase is completed, we've already part of our discovery is understanding where there could be use cases. And that's where we move into the adoption and empowerment stage. So when we get into the discovery and readiness, I gave you a pretty good high level overview on what this is, but part of the process is making sure that we pull together with you the key stakeholders from within your organization, so that we have the right representation from both the security perspective, from the technology perspective, and also from the use case perspective. So we'll work with you on collaborating on who that team really should be, and then from there we start moving into this phase.
The discovery and readiness phase, I mean, I do think it's really important, to sort of caution, avoid rushing for mass deployment of Copilot. It's super exciting just to dive right in and get started. However, we need to really understand the Office 365 environment, how it's configured with Copilot, because it's risky if we don't have data secured, right? Without assessing the Microsoft 365 setup, we could inadvertently turn on Copilot and allow it to surface outdated, irrelevant, or even sensitive information for the wrong users. Just as an example, if access permissions aren't aligned correctly, we might accidentally expose confidential HR documents or executive salaries in everyday Copilot prompts. That's why it is critical to move through a proper discovery and readiness phase before we move on to our second phase, which is really the security and data protection.
Yeah, and that's what sets the stage then for what we do in phase two. We have a very good roadmap on the security and data protection. Mel, can you just move over to phase two? It hasn't updated on our side. There we go. Thanks. So this is where we shift from understanding your environment to actively securing it for Copilot. So it's not just about tightening controls for the sake of it. This is about preventing real avoidable risks that could arise if Copilot's rolled out without the proper safeguards. So we'll address specific gaps uncovered in phase one by hardening your 365 environment. And because Copilot is only as smart as the environment it operates in, this phase ensures your data isn't just accessible. It's accessible only to the right people in the right context. So think of it this way. Phase one's discovering that someone left a door unlocked. Phase two is where we install the deadbolts, put a sign on the door, and hand out keys only to the people who need them. It's this proactive approach that enables Copilot to operate safely and effectively without unintended exposure of sensitive or outdated information.
And then phase three, this is where the magic happens. This is where it becomes really exciting, the adoption and empowerment with the users. This phase is all about empowering your team to use Copilot confidently and effectively, because even the best tool is wasted if our teams are not adopting it. We go beyond flipping the switch at IT Solutions. We provide practical enablement, showing healthcare organizations and teams how to use Copilot in their day-to-day workflows, sharing use cases, offering simple training that sticks. We also monitor adoption and report on usage to help avoid wasted spend and unused licensing. Our goal is to turn Copilot into a productivity multiplier, not a line item that gets quietly ignored.
We'll send out to the group some links to Microsoft sites where Microsoft has a Copilot scenario library. It's just another helpful resource that shows examples of top use cases in the healthcare industry. So the more you kind of have exposure to seeing how other healthcare providers out there are using it, the more it's going to give you ideas on different ways that you can start using it. And part of that three-phased approach, I did mention that we're going to work with you on figuring out, what are some of the most effective ways right out of the gate you can start to leverage Copilot. And we may just start doing that by, a smaller group, like we were describing the key stakeholders in the organization, working with them. But then we may want to roll it out to a larger group. And part of that deployment may even be rolling out the licensed version to a smaller group to start like a test pilot, and also deploying the free version to all users and helping you to make sure that people are adopting and using this safely. And because if you're not, chances are they're going to be doing it on their own, and chances are they're going to be using ChatGPT, and that's potentially going to be exposing sensitive information, client information, patient information, but potentially. So want to make sure that we're deploying it in a safe, controlled fashion, and understanding the fact that people want to use AI and people know that it can help them in their day-to-day functions. So the more you can embrace that, and the more that you can control the deployment of it and the security of it and the use case of it, the better the outcome will be and the safer your environment and data will be.
It's such a good perspective, Tyler. And that's really why, right? When we would talk about why partner with ITS for a co-pilot deployment. Again, we're as a trusted partner, the deployment matters to us. It is critical that each phase of that deployment be well thought out, architected, and articulated for a firm adoption and really a good outcome as per the strategic advisors and our technical team are eager to support your Copilot adoption journey if you do choose that path forward. We're uniquely positioned to support that journey alongside you. As a Microsoft certified partner, we've done the legwork to test and operationalize Copilot. And our readiness program is designed to help healthcare organizations adopt it securely and effectively without reinventing the wheel. The truth is, there's so much more opportunity than we could fit into this session, from workflow automation to long term Copilot governance. We're really excited just to get started to uncover what's next, and we'd love to continue the conversation with you all. So, before we wrap and move into some Q&A, I want to zoom out for just a moment. Microsoft Copilot is transforming how work gets done for healthcare organizations across the world. But to unlock that potential, it takes more than a license. It takes planning, protection, and a team that's ready. I want to just remind everyone that first and foremost, success with Copilot starts long before we enable the license. We need a strong foundation. And knowing what data Copilot can access, who has access to that data, and whether the environment is actually ready is all critical. Rushing in without that visibility puts the organization at risk of compliance issues, confusion, and/or wasted spend. Secondly, Copilot Readiness Program was built to help you avoid those pitfalls. From discovery and security to adoption and empowerment, we walk you through every step to ensure your rollout is secure, that it's aligned to the organization's needs, and delivers real business outcomes. And lastly, even the most powerful tools won't make an impact if our users do not adopt them. That's why our end user enablement is core to this program. So we don't just launch Copilot, instead, we utilize and realize its full value. We are coming to a few key cities in the coming weeks. We'd like to host some upcoming in-person events to talk more about a Copilot readiness program, and also to talk about vCISO and cybersecurity, how those two things run complementary to one another. It's a great opportunity to connect, learn, and collaborate in person. We're hosting events in these 4 cities near you. So if you'd like to attend, please reach out to your strategic advisor and they will be happy to reserve a spot in one of these exclusive events. We hope to see you there. So as that said, I do appreciate everyone joining us. Tyler, thank you so much for your time today. And while I still have you, I'm hoping to ask a few questions that came in through our chat and through the Q&A while we were presenting today. So if I
Sure.
can open it up to you, let me start with, this is a fantastic question. And of course, it's number one. Is Copilot HIPAA compliant?
Yeah, I figured that would be one of the first questions for sure. So, yes, it is covered under Microsoft's HIPAA Business Association Agreement. But HIPAA compliance depends on how you configure and manage access, right? So that's why we help you secure your data, verify everything is and make sure that it's documented before the deployment. That's why that phase one is so critical because we want to make sure that we understand where all the sensitive data is in the environment, and then how we can put the correct data classifications and external security in place. It's think of it very much like file shares even on an old file server and stuff, and you have to manage the permissions of who has access to the finance folder or the HR folder, the
Mhm.
payroll folder, all of those things. It's very similar here. The difference is that Copilot is much better at being able to search data in the environment. So if you've ever gone in and searched the Windows folders for a specific document, it's not great at being able to return results. It's a little hit and miss. If you're searching Outlook for an old email, it may or may not find it based on how the parameters you feed it. The difference here is Copilot is very good at those things, and it can query very quickly, and it can take fewer pieces of data that you want to query by and be able to find stuff. So it's imperative that the data classifications are in place.
Thank you, Tyler. We had a question through the chat from one of our attendees. Nathan Norman asks, is there a way to have Copilot completely disabled in our tenant until we are able to get the solution implemented? Users are seeing Copilot prompts in Outlook and Word already, and there's some concern in the organization about allowing those users to have access to that tool without a firm policy or practice in place. Tyler, can you talk to us about that?
Well, yeah, this one it supports exactly the approach we're recommending, that we go through and do these three phases. If it's not licensed, I don't think it would be able to query anything in the environment, and it's just it is embedded in those applications, but likely not able to do any queries. Um, but we'd be happy to look into your specific example also and make sure things are configured properly there.
Perfect. I'll take a note to follow up with Nathan after the webinar on any additional questions there.
Great.
We had one more in the chat, Tyler. I thought this was a really good one too. How do we prevent Copilot from surfacing PHI, protected health information, to the wrong staff members?
It's yeah, it comes back to this data classification and really understanding where your data resides. So part of what we do in this discovery phase is we will be looking through all of the data repositories, SharePoint and stuff, and then
Mhm.
being able to identify where that data exists. So we'll work with you then to apply data loss prevention policies, access controls, sensitivity labels, so that the PHI stays protected. And then a lot of testing to make sure that we're validating that people aren't able to search on information, or at least be able to get results back on information they queried based on the access controls we've set. And also being able to probably pilot it with a few people internally first, ones that do have access to all of the information and should have access, so that over time you may think of something. Oh, well, what if if somebody had access to this? We can identify that and put the right data classification on it.
Perfect. Tyler, thank you so much. This session was really helpful in understanding, first of all, what kind of AI model Copilot is and how we could potentially use it with our healthcare clients. Thank you for your time. And I think
Likewise.
we had a really good session today. I'd like to
Mhm.
thank all of our attendees. Again, we'll follow up via email with all the materials that we spoke about. And if there are any questions that you have that we didn't cover today, please reach out to your strategic advisor, and we'll be happy to set up additional conversations as needed. Thanks, everyone. Have a good day.
Thank you.